next we call upon the next paper, Novel Drug Repository Contact Lens Study Prolonging Antimicrobial Contact in Bacterial Keratitis, Dr. Lionel Raj.
Good afternoon, chairpersons, dear friends. I do not have any financial interest or relationships in the paper which relates to a drug repository contact lens in lengthening antibiotic corneal contact and hastening bacterial keratitis healing. Reports of a randomized control study. Up to 5% of all blindness are due to infections in the eyes. And in our region, down south of India, it's 11.3 per 10,000 population. So it's quite huge. So there is an unmet need, and there is a strategy for novel therapies which has to come. And presently, topical dosage forms are the treatment option in loading doses. However, precorneal factors and anatomical barriers, they negatively affect the bioavailability of drugs in the lesion. With this background, we propose to evaluate the efficacy of a novel therapeutic contact lens that increased overall contact time of corneal antimicrobial agent serving as a drug reservoir in subjects with BK. It's a randomized open label clinical trial. 40 eyes were randomized into group 1 and 2 in 1:1 ratio. Group 1 receiving only topical agents, whereas group 2 with the drug reservoir contact lens. 3 and 2 cases out of both the groups did not complete the study and were excluded from analysis. In both the groups, a standard dosing of moxifloxacin 0.5%, 2 hourly for the first 3 days and 4th hourly for the next 12 days were instituted. Followed up on 12 hours, days 1, 3, 5 and 14, and also a pain analog scale was followed. In addition, a drug availability study was also performed. So this is the proprietary design which has a dual base curve lens as to make a central reservoir and also fenestrations which enables capture of every time applied antimicrobial agents. The results. Corneal infiltration, the bacterial keratitis severity score was comparable between both the groups initially. However, the first 3 days, the effective healing was more in drug reservoir contact lens group. And the effective healing started after 3rd day, that is on day 5 and day 14, till day 14 in the other group. That means hastening of healing happened with contact lens group. So this is a case of gram-positive ulcer, and this is by 12 hours, and by day 1 you can see more than 50% healing, and day 3 almost completely healed, measured by OCT also. Another case example wherein again by day 1 you can see a significant healing due to drug reservoir contact lenses. Pain was also comparable between either groups. However, pain reduction was very significantly better by 12 hours, 1 day and 3 days in the contact lens group. Similarly, a mean of 1.5 line improvement in vision was noticed by day 1, which improved by another line by day 3 in contact lens group. That means significant visual acuity gains were possible before day 3. The pain which I spoke, yes, the pain significantly reduced in the first 3 days in the contact lens group. And so did corneal haze and AC reactions. That all says that the first 3 days are crucial, and the first 3 days effective healing was better with the contact lens group. Ulcers which were more than 4 millimeter in size, the larger ulcers, the effective healing started in 1 to 3 days and resolved within 2 weeks. The drug retention studies, here we employed a triamcinolone which is used during surgeries, which doesn't stain lens but stains the vitreous, was used as a testing agent in our drug retention studies. And the drug availability in the precorneal space immediately peaked after application and stayed in the precorneal space till the period of 4 hours. That means the drug, antimicrobial drug, would remain in the precorneal space for 4 hours. So poor drug availability is a major concern. We aimed in retaining the drug in the precorneal space rather than sustained drug release systems. And since all these parameters proved that before third day effective healing started, we recommend the treating physician, corneal physician, to use the lens for 3 days, and after 3 days they can continue or they can withdraw based on the clinical response. And further studies as well as extension studies have been done at our center, and also we are doing multicentric studies to gain more efficacy data. To conclude, drug repository contact lenses may be indicated for therapeutic use to promote effective healing and pain relief in bacterial keratitis. The concept of using novel drug repository contact lens over the lesion is effective in prolonging corneal antimicrobial availability, which can affect the overall outcomes in BK. And this can reduce the regimen of antibiotics, decrease the burden on the medical staff, it can improve patient tolerance, reduce drug toxicities, and may change the present practice pattern of loading dose concepts. Thank you for your listening.
About the contact lens, I mean, does it prevent you from evaluating the ulcer we do usually? I mean, the visibility and the scattering of light and
No.
other factors, the debris and which collects inside. Because you are once you put it, you are going to keep it for longer time, right?
Yeah, but during the study, that is what we recommend. At least for the first 3 days, you do so. But during these studies, we remove the contact lens, we stain, we find out the lesion size also. And as you rightly said, we can have mucus strands,
Yeah.
especially on the fenestrations.
Yeah.
What we advocate is that you can wash with balanced salt solution. Or
So you have to
can
remove.
always remove, wash and reapply.
So patient has to come for those visits again and again.
We admitted because 12 hours, 1 day,
Okay.
this is a trial, randomized
This is a
trial.
trial.
So we can't have too much of variance.
And were these bacterial culture proven
They
ulcers?
are,
And all were sensitive to moxifloxacin.
they are. I'll tell you how did we do, because the methodology, entire methodology we cannot squeeze.
I'm concerned all those ulcers were culture proven sensitive to
No,
moxifloxacin.
I'll tell you.
Yeah.
All the cases are proven BK by gram staining,
Okay.
and 80% were culture positive. So culture results,
But
we
not
will-
sensitivity was not done.
no, culture and antibiogram we cannot get it before the trial starts.
Okay.
So based on the, since we have a microbiology unit in our center, we do.
So, but at least till the time you complete the study,
Yeah,
the
let me-
bacterial culture would be available, isn't
Correct.
it? Yeah.
Let me complete.
please.
Let me complete. So we do microscopic studies only if it is bacteria, either gram positive or gram negative, and if there are no fungus on the KOH, then we recruit into the study.
Right.
We get the antibiogram reports after 3 days. Here we used moxifloxacin as a standard thing. Monotherapy with the quinolone is still being advocated, and fortunately 36 cases, that's why I said 36 cases could complete the study with single drug. If there was
Worsening.
a worsening, or if there was a need for any other drug, then we excluded from the analysis, but still it's an ongoing thing. So we are also thinking about having dual antibiotics. If it is gram positive, to go ahead with quinolones, gram negative to go ahead with the aminoglycosides.
Okay. Thank you.
That's
And
what is the
How
methodology.
frequently do you change the contact lens?
Only if it is lost, or if it is too much clogged or damaged. Otherwise we can just wash or flush and reapply.
For how
They're
long?
quite expensive.
How long? How many days?
At least for 3 days. That's what we suggest, at least for the 3 days, because we see effective healing within 3 days. So for the first 3 days we recommend the physician to have. After that, based on the clinical response,
And how frequently you call the patient for follow-up? Every day or maybe?
all these cases we admitted the patient because it's a RCT, but I think it's wise to call them at least once in 48 hours. Thank you.